Hi guys, let's talk about the premise behind testosterone replacement therapy. Should seem rather simple. The clue's in the name. Testosterone replacement. Replace the testosterone. Job done. Let's all go home. Simples. It's a little bit more complicated than that. Why is it more complicated? Does Dr. Stevens want to make it complicated? No. I want to do best by my patients. I want to act in the best interests of my patients by giving them a more logical and methodical approach to something that I think has been treated very poorly by the NHS and by the private sector. Because I believe there's a short-sightedness in offering testosterone monotherapy as the gold standard. Because I don't believe testosterone monotherapy is the gold standard. Well, Dr. Stevens, I've got low testosterone, so surely replacing the testosterone is all I need to do. Let's think about it really. Because if the premise of testosterone replacement therapy is replacing testosterone, all good and well. But we shouldn't be looking at TRT like that. We should be looking at it as hormone replacement therapy and maintaining function. Testosterone monotherapy is a really short-sighted approach. If you have an understanding of physiology, you would question why we are simply replacing testosterone when we know that testosterone suppresses the release of LH and FSH down to the testicles. So in medicine, you should do no harm. Does testosterone monotherapy cause harm? Well, yeah, it does, doesn't it? Because you're suppressing LH and FSH. So you are not sending those signals down to the testicles and other organs to maintain testicular function. Testicular function, what do you need it for? I don't want kids. Okay. Do you want to have tiny testicles? Is it purely an aesthetic cause or consideration? Testicular atrophy is actually associated with pain in a lot of guys. So whilst having tiny testicles may make your schlong look a little bit bigger, instead of shaving apparently, it's all relative. It can cause pain. So everybody knows about the benefit of HCG in maintaining fertility. Everybody knows about the fact it can cause testicular atrophy. But along with that testicular atrophy, you can also have pain. I don't like pain. Well, sometimes I do. But that's between me and so it isn't simply about fertility. There are also LH receptors in other areas, most notably the brain. So guys on HCG feel a qualitative improvement in their sense of well-being and libido. Does it work for everybody? No, it's a principle, not a rule. So when we think about TRT, we should be thinking about maintaining function as best we can. Do no harm. Makes sense to me. So why would you be anti-HCG? Because you don't need it. Well, I think you do. Fertility, testicular size and function, cognition, libido, and there's purported upregulation of the hormones down from pregnenolone, but that's been unsubstantiated in studies, so it's theorized. So we display a level of ignorance that is astounding, really. we have this assumption that we know everything. But surely we should be having a more progressive attitude to TRT. Addressing the foundations. Now, if you think about the causes or the types of testosterone deficiency, you're going to think about a primary cause, which is a problem with the testicles, or a secondary cause, or a mixed picture. So, a primary is a problem with the testicles, so you will have an high LH and FSH. Do you have complete testicular failure in the majority of guys with a primary hypogonadism? And the answer to that question is no. But it's bad enough that it's causing negative symptoms from having low testosterone. Complete testicular failure. It's obviously rare. So you can maintain some function with HCG. I'm really uncomfortable with the idea of shutting my testicles down. It seems illogical. Even if you don't want kids, even if you don't want normal sized testicles, it just seems weird. It's just a really odd concept to go, I'm going to let my nuts shrink and atrophy because, you know, I don't need them. I find that quite odd. So if you have a secondary picture, you'll have low LH and FSH. So again, you can say, right, just replace the testosterone. But if you replaced the LH with HCG, you could regain some testicular size and function if necessary. Seems to make sense to me. And if you think about the levels, they're hard to quantify, if I'm being perfectly honest, because we don't have any real kind of statistically significant data to say this is the level that you should be aiming for. So it's quite non-scientific in the perspective that you're just giving a dose and seeing the response. Is that bad? No, not really, because we're actually all biologically unique. So my perfect testosterone level will be different from your perfect testosterone level. And what's actually really more important than your absolute numbers is the ratio. The ratio of testosterone to estrogen to DHT. And there's a certain cohort of people who recognize that estrogen is elevated in our society through a multitude of reasons. So their argument is, well, you can balance it out by just keep upping the dose of testosterone. No, you can. Because obviously there will be a maximum amount of aromatase enzyme. So if you just keep upping the dose, then you can balance testosterone and estrogen. Does that mean you should? Because it's all about the ratio? No, obviously not, because having high testosterone levels is associated with blood pressure, a decrease in HDL, which is a protein that takes cholesterol away from the cells, and a rise in LDL, which takes protein. It's a protein which takes cholesterol to the cells. Your hematocrit can rise. Yes, we know it's not the same as polycythemia vera. Give me strength. Oh, but I've worked it out. You've worked it out. You've worked it out wrong. If you're thinking it doesn't matter because people with COPD have raised hematocrits and they don't have to donate, well, they need that raised hematocrit because they have a relative decrease in oxygen. And the people that live at high altitude, they have raised hematocrits and they're okay. It's called genetics. So what else? SHBG. You don't have to worry about SHBG. Just keep up in the dose. Okay, that's interesting. Why do we have these hormones? Why do we have these glycoproteins? It's quite perplexing. The reason why they don't care about HCT and SHBG is because super high levels cause a rise in HCT and a drop in SHBG, so it doesn't fit in with their doesn't fit in with their methodology or their argument. So just pretending it doesn't, you don't need to bother about it. It's quite frankly ignorant, because if you don't appreciate why we have these chemicals inside our body, and I don't fully appreciate why we have all these chemicals and every function, every role of these chemicals, but I recognise there must be a role. So if you take SHBG, SHBG is fascinating. It's a glycoprotein produced by the liver. What's it for? It's a buffer. So testosterone, estrogen, dihydrotestosterone have super short half-lives. So you need to have all of those hormones 24/7, but in varying proportions. So we are anabolic predominantly at nighttime and catabolic predominantly in the daytime. So do SHBG levels fluctuate naturally? And the answer to that question is yes. So SHBG rises in stress. Why does it rise in stress? Because that seems very much counterproductive. Stress is counterproductive. We shouldn't be stressed. It's an abnormal physiological reaction. So I've got a guy who's not on TRT, but we've been seeing him with his SHBG because it's reducing his bioavailable male androgens. And he notices when he's on holiday, his morning erections come back and his sense of well-being comes back and his libido comes back. And I'm sure it's due to the fact that his elevated SHBG that he has in normal day-to-day life, because he's super active and he's super busy and he's super stressed, lowers. Now again, if you think about catabolic and anabolic, why would you have a constant SHBG? So SHBG fluctuates, so it's a buffer, but it also fluctuates because your physiology needs differing levels of testosterone, estrogen and DHT at different times of the day to help facilitate the function and role of those three hormones. Kind of makes sense, doesn't it? So to say you can just ignore SHBG because it doesn't fit in with your philosophy, then your philosophy is wrong, in my opinion. I always give that caveat. So we should be having a logical, methodical approach to TRT, treating it as hormone replacement therapy, not testosterone replacement therapy. Understanding that as much as we try and mimic natural physiology, we cannot perfectly mimic it, because obviously HCG is not LH, it mimics luteinizing hormone. If it was identical, it would be called LH. But we know that it mimics luteinizing hormone. How it binds to the receptors is different, but it mimics. It's not identical, it mimics. And we actually want it to be a mimic rather than identical, because again, the half-life of LH is super short. And if we're trying to attain stable levels, and that is the purpose of testosterone replacement therapy, stable levels, stable controllable levels, then we want something with a longer half-life so that we can achieve our goal. So as close as damn it, it is the most effective way of achieving testicular function, and stimulating the other electroreceptors in the body. It's purported that there's also upregulation of other hormones down for pregnenolone, but that can't be proved, unfortunately. So not in human studies. So which is quite disappointing, because it'd be nice to have that in the argument as well. But it's not really about that. It's not really about the argument, because I don't really care what you do. I'm not here to tell you what to do, not to tell you what to think. I'm just here to tell you what I think. And it's interesting. Clinicians can disagree as long as they can justify their clinical practice to the regulatory bodies. And I can justify my practice, actually forgetting the regulatory bodies. I can justify that practice to myself. So I'm not the smartest guy in the world. I'm definitely not an academic. We have got a medical researcher on board now, alongside an ever-growing team of our nutritional advisor and an advanced nurse practitioner who will be launching their own programs in the very near future, which is exciting, because we want to offer our patients a holistic approach to not only testosterone but really health, because testosterone affects numerous organs. Our understanding of the role / importance of these three hormones that we've spoken about in long-term physical and psychological health is constantly evolving. So we're eyes wide open. There is no dogma at the Men's Health Clinic, because medicine is a practice. Practice is ever evolving, but hopefully we are continuing to refine and improve the service that we offer our guys. And that means that we're going to start incorporating nutrition and lifestyle, because it always comes back to the same thing: balance. Life is about balance, but it's about appreciating duality. So much like catabolic versus anabolic, let's extend that into everything, because it does extend into everything. Night and day, love and hate. I'm going to start chanting in a minute. I'm massively into Alan Watts, and I've been listening to a lot of Carl Jung recently. The shadow. We all have one. Don't be afraid. Step into the darkness. Understand, accept, rationalize the darkness. You can only ever be sane if you do that. But it does boil down to that. It boils down to appreciating the need for balance. So when it comes to testosterone, anabolic, it comes to cortisol, catabolic, they have a common precursor, pregnenolone. Now, if you're natty and you're cortisol dominant, you'll have a relative decrease in aldosterone and testosterone if you allow that cortisol dominance to persist. Now, in our states, because we're useless at coping with stress and anxiety, and we're so focused on achieving something that doesn't really need... I don't know what I'm saying now. It's getting late. It's 19 minutes and I'm getting a bit knackered. I think it's literally about understanding yin and yang. You can't have darkness without light. You can't have angry people on YouTube without peaceful people. Namaste.